So let's talk about you for a moment, especially now as you look back on it, and perhaps during those early months, you were just nose to the grindstone, getting things done. But tell us a little bit about what your life was like during, March and those early months, and then when you had the opportunity perhaps to take a deep breath, or maybe you didn't, when the Lakers hoisted that trophy, and that was the end of the bubble. How did that feel?
It felt so great to get to that point because it took so much time and effort and commitment. And I can't tell you the massive exhale of exhilaration of we did it. It felt like a dream. I remember the night that it came to an end, and just being there, just shaking my head, saying I couldn't believe that we had done that. And I mean, I was tearful. I felt so responsible for so many lives. All of these people are my colleagues, but at some point you make the transition from colleague to patient. And so I really honor my Hippocratic oath, and I value the doctor patient relationship and building that trust. And so that was great to get to the end. But in those days, those early days of March, leading up to the bubble, I was still practicing in the emergency room. I was still working with the NBA, thinking through solutions of how we could resume, gathering information, tracking what was happening with the pandemic. And it was exhausting. It was a very challenging time. My hours were very long, very early, very late, and my sleep did take a hit. However, I leaned on the things that are most important for keeping me grounded, exercise being number one. I made sure that I found that time, whether it was going for a run, going for a walk, just getting out. I needed that downtime. Dr. Harris, I'll tell you, I tell people who know me, if you want to get a sense of how I'm doing, rather than saying, Leroy, how are you doing? Ask me, have you worked out today? Or do you have a plan to? If I can work out, that means I found the time, I made the time, that's a good day. You can ask me, how much caffeine have you consumed? Generally, a cup of coffee in the morning, I'm good. If I have to supplement that with an espresso or two, that means that I haven't been sleeping much, and I'm going. Number two was my family. I made sure that we had time for each other, and we started to institute things to make sure we had touch points, whether it was family movie night on Fridays or getting on our bikes and going for a ride. We made sure that we had time together because the work could be consuming. We made the pivot, remember, to schools going remote. So all of a sudden we were all here and we had to figure out how to live in this space. But also I relied on my faith, which makes a big difference for me and my community, making sure that I kept in touch with my family, my grandma, mom, dad, brothers and sisters, my best friend, and that we didn't drift apart. And so having those breaks, those opportunities were really important. One of the things that our hospital did was they provided free mental health specialists for frontline workers. And I made sure to pair with a therapist. And we had an appointment every Tuesday at, it was 4 p.m. Pacific time. And I kept that appointment through the bubble all the way through December. So I started with her in April or May, and we met weekly. And that was a time for me to address anything that may have been in my blind spot. I don't pretend that I am a plumber or that I am a mechanic. When things in my house or my car need attention, I go to a specialist. When I'm dealing with a pandemic and stress, I go to a specialist. And I made sure to let people know, because I know there's that stigma of mental health and having a provider. And I let people know, sorry, I can't do that, or I can't cover that game. I have an appointment with my therapist for this hour. And try to normalize it, take away some of the stigma. And that helped as well. So I made sure to pay attention to exercise, made sure to eat well, to build upon those relationships that had sustained me, my faith. And then I had a therapist who helped me as well.